Hi, my name is Dr. Juliana VanderPluym. I am a pediatric neurologist who also sees adult patients as well, and I'm currently working at the Mayo Clinic, Arizona. Migraine isn't just a headache disorder, and we're learning that there are phases that migraine patients go through. So when we think about interictal, really what we're talking about is the headache phase versus the non-headache phase. And there is a lot of things that can happen in the non-headache phase. Basically, in the non-headache phase, people can have, before their headache, what's called the premonitory phase. And then after their headache, they can have what's called the postdrome phase. So in the premonitory phase, people can experience a lot of different types of symptoms that they might not think actually relates to their migraines, but indeed may. And these can include things like neuropsychiatric symptoms. And what I mean by that is basically feeling tired, feeling drained, having changes in your emotional state, having changes in how you're thinking, maybe feeling like you're a bit more slowed down. People can have sensory symptoms where they're sensitive to light or sound. They can have gastrointestinal symptoms where they might feel nauseous or even have food cravings. And then they can get a variety of other symptoms like stiffness in the neck, increased yawning, which might sound a little bit strange, or even the need to go to the washroom more or urinate more. And those can actually be indications that a migraine attack is coming on. Various studies have looked at this, and it's been found that patients, about 80% of patients report having a variety of these types of symptoms. And then for the postdrome phase, people can again experience similar symptoms to that, the most common ones being though a feeling of being drained, tired. For people who may drink alcohol, sometimes I've had patients describe it almost like a hangover that they have. And again, it's about 80% of people who describe those types of symptoms. So that's one component of interictal symptoms. Another component of interictal symptoms is actually anxiety that people might have in relation to their next attack. So we know that migraines come and go and that we often can't predict when they're going to happen. And so this can cause a lot of worry for people because no one wants to experience a migraine, and if we don't know when it's going to happen, they always feel like this is affecting their day-to-day life because they want to plan things and do things, and they worry, well, am I not going to be able to because of a migraine? And so one study found that about 10% of people reported this anxiety, and then another 15% of people were actually changing their life, canceling plans that they made, basically to accommodate their migraine. Well, first of all, I think it helps you potentially understand when you might be getting a migraine. Because again, we might be misattributing these symptoms to something else. If you're feeling a bit irritated, or if you're feeling a bit more tired, if you're feeling like you're having neck pain, you might think, oh, well, maybe I'm just coming down with a cold, or I ate something wrong. But it might be actually not out of your control. A good example of this is triggers. So we talk a lot about triggers and this idea that maybe I ate something wrong and that's what caused my headache. But interestingly, as I had mentioned before, food cravings may be part of this premonitory phase. So it might not be that you ate something and caused your migraine. It might actually be that you craved to eat something, like chocolate, for example, and you had the migraine anyways, because that craving is actually just part of your migraine. So again, it's this idea that you're not causing this, this is just part of the disorder itself. We don't have a current treatment available. My research that I've been doing has been looking into potentially evaluating that as part of some clinical trials that are out there. And we found that the people who got the CGRP medication versus those that didn't actually did report more days where they felt well. So the medication potentially was affecting some of those symptoms in between. Again, this is just the beginning of the road for understanding, but I think what it really tells us is that we do need to be looking more at non-headache symptoms associated with migraine and evaluating them in things like clinical trials and really studying this more. And by being able to identify your migraine early, we may be able to treat it early and then more effectively address migraine altogether and not just the pain of migraine.